Hello friends, my name is Saravanan. I am from Chennai. I studied my bachelor degree in Government College of Physiotherapy, and I live in US for about 25 years. I am happy to present a course for the IAP pre-conference course um, for a day on March 5th. Unfortunately, I couldn't travel there, so I'm going to do the live stream online course. The format is going to be a lot of videos and then live demonstration of lab sessions. And I have someone to help me during the course to supervise the techniques. Why vestibular rehab? I I started to see some patients with the dizziness and imbalance, and then I saw that there should be a lot of potential for a PTs to grow. So it's like a growing science, and I started to treat some dizzy patients, and then I saw immediate success. So I started to teach not because of I'm a good teacher, it's because of my passion. So what is this vestibular rehab? Uh, Basically, we have inner ear system, which as a PT we never study a lot of anatomy and physiology of inner ear system during our bachelor degree. So we always study about musculoskeletal and orthopedic conditions. So this is something unique. The basic idea is any movement related disorders, as a PT we can treat them. For an example, if there is shoulder dislocation or a TMJ dislocation, we move in a certain way so that we can correct the issues. So any movement-based disorders, as a PT, we are the first hand specialist. So there are movement happening in the inner ear system itself. There is a movement in the fluid, which also gives impulse to the brain to react in such a way whether to give a balance or dizziness too. So we can move back. We can correct the movement in the inner ear system by way of a vestibular therapy to correct the problems. This is the basic idea of what is vestibular rehab. To give some basic information about vestibular system, who is not much familiar with, the inner ear system has three canals on right side and then the left side, and which gives signal to the brain how the head is moving. When the head is moving, the canal is moving too. It gives signal to the brain where I am moving and which direction I am moving and what speed I am moving, and also it gives information about where my head is located too. In response, the brain receives information from the inner ear system. It gives commands to the rest of the body or the eye muscles to do their normal motor function. If there's a conflict between the information from the inner ear system to the brain, and then the brain gives information back to the eye muscles and the neck muscles. If there's a conflict in between all the chain, it is imbalanced. That's what we call like a sensory mismatch, which gives imbalance to the body, neck muscles, and dizziness. And also, dizziness is something that the head is not moving, but we feel that we are moving. It's because the improper signal is given by the inner ear system to the brain. So this is the basic idea of a vestibular system. So one day is not enough for the course, but I plan that this course in such a way that anybody who's experienced or who don't know anything about a vestibular rehab, we're going to start with the anatomy and physiology of the vestibular system, and then we're going to talk about some specific conditions which cause dizziness and imbalance, and then we're going to talk about more about how to assess the patient, like as a PT, when the patient walk to the door, walk with the dizziness, how to assess the patient, and then make a clinical judgment based on the assessment and what kind of treatment we can give. There are a lot of conditions with the dizziness imbalance, especially if there is a condition called BPPV, which is like displacement of oroconia into the inner ear system, which can cause improper signal to the brain, can impact, patient can have a severe vertigo, nausea, and then they may end up going to the emergency. So these kind of conditions can be treated successfully within 1 visit to 5 visits. So we talk about the BPPV and then our management, and we're not going to talk about just the BPPV. We're going to talk about like a general dizziness, imbalance, and vertigo, lightheadedness, and all those things. How to assess? We are not going to treat all the dizzy patients, but this course will give you at least to screen what are all the dizzy patients which we can assess, and what are all the dizzy patients we can refer back to for a cross referral to the specialist. I would like to see you through online on March 5th, and then I intend to do the follow-up course if there is a demand to come to a live course, so that we can do a lot of practicals and everything. I'm not promising one day that you'll be like really well versed with the vestibular rehab, but I'm confident that within a day you'll have some basic idea and to go and can start evaluating and treating dizzy patients after you attending this course. Thank you so much, and wish you good luck for the Chennai conference. And I'm so happy that being from Chennai, the conference is happening in Chennai. I wish I could be there to meet all our friends and everything. Hopefully next time. Thank you guys. Have a great day. Bye.